right, and thank you guys for texting in. That makes it very nice. All right, phones at the ready. Insulation failure-related injuries, 1, will be evident on the screen during laparoscopic procedure. 2, produce a greater thermal effect when there is a larger break in insulation. 3, can be avoided by using an active electrode monitoring system. Or 4, are best prevented by inspecting the shaft of the device before use. An important question. All right, let's take a look and see what you all said. Interesting. All right, so certainly they may not be on the screen during your laparoscopic procedure because a lot happens off the screen. Also, a larger break in insulation would create less of a problem, so fortunately none of you said that. The correct answer is 3, though. They can be avoided by using an active electrode system, and there is a company that actually creates instruments that have an active electrode system, and that absorbs any stray currents that can come through. It's not a normal, it is certainly in the insulated devices, but that has a way to withdraw any stray current through the system itself through an active electrode. They are not best prevented by inspecting the shaft of the device because it's the smaller holes that create a larger problem in the insulation, and you won't be able to see those. So most hospitals have an electronic device that is used to check all of the insulation between all of the cases. But as Pascal says, it's not 100%. Most of the injuries, though, we see are capacitive coupling injuries and not insulation failure injuries, so that when you're doing a lap chole and you touch the side of the instrument, say the cautery, to the liver, and you see a little burn along the liver, that's a capacitive coupling injury.
As a matter of fact, what we recommend as cues for you is that you assume that every instrument you use has an insulation failure, and that you work in such a way that you always are aware of where your instrument is touching something. That really is the best way to prevent insulation failure. Because even a new device out of the box can have an up to 30% chance that there's a crack in insulation. So you basically avoid insulation failure injuries by assuming that you're working with insulation failure. Make sense?
Wow.
The tricky part of this question is that it says it can be avoided. Certainly, it could be reduced, or can be, it's a good idea. Can you avoid it 100% with an electrode monitoring system?
Yeah, you can. It's like 100%, pretty close to 100%.
Pretty close to 100%. So it's whenever you see an avoid or an
As long as the system is working.
Yeah. So yes, I agree. This is not a good question.
I agree. It's a little tricky. So I was oscillating between 3 and 4 because of that, and always down. But your point is well taken.
Next question. The cut mode on the electrical surgical unit, 1, uses an interrupted high volt waveform. 2, uses a continuous low voltage waveform. 3, uses an interrupted low voltage waveform. Or 4, uses a continuous high voltage waveform.
100%.
We're looking for 100% here. All right, let's take a look at what you answered. Excellent, good job. Excellent, excellent. All right, next question. Choose the safest practice to minimize risks due to capacitive coupling. Wrap the cord of an electrosurgical device around the metal towel clamp. 2. Keeping the cords of all devices together under a secured towel or magnet. 3. Wrapping the cord of an electrosurgical device around the green plastic clip. Or 4. Having an assistant hold the instrument between uses. All right, let's take a look at your answers. Pretty good, pretty good. So this is really a great question because a lot of hospitals are still using metal clamps to help you tie your devices down, and you really should not be tying them down, the electrosurgical cords on metal towel clamps. And the more and more that you wrap the electric cords around the towel clamp, the more likely you are to get a stray jolt of electricity through the metal towel clamp. Keeping the devices together also can be a problem because they can interfere with each other and augment each other. So they should actually, the electrosurgical devices should not be coming in together. Wrapping the cord around a plastic clip does obviate that problem to the most part to keep stray currents from occurring. And the last one is kind of silly. All right, next question. Identify the flow of ions in the electrical surgical circuit used with monopolar instrument. Now, this is not a perfect question because, of course, these are alternating currents, but nonetheless, what we want to know is the general direction of how things are occurring. Power outlet to generator to power setting to dispersal electrode, power outlet to active electrode to foot pedal to dispersive electrode, generator to power setting to blend duty cycle to dispersive electrode, or generator to active electrode to patient to dispersive electrode. All right, let's take a look and see what you said. Very good. Excellent work. 100% to all of you.
It's actually a trick question because there's no ions in any of those things. They're electrons. Ions are really not present.
Yeah, I see.
I was a physicist.
You're absolutely right.
Good. Very good. Okay, next question. You won't see that question on the real exam. Which of the following statements is true regarding the endoscopic snare? 1, the snare does not require dispersive electrode to be placed on the patient. 2, the smaller the base of the polyp, the more energy is required to section it. 3, because the snare compresses the tissue it encircles, there is no risk of perforation of the bowel. Or 4, direct coupling can injure the bowel wall on the opposite side from where the polyp is based. I think we had a nice discussion of this on the endoscopic section just a few talks ago. We can see if you all listen to that. Let's take a look at your answers. Very good. You all got that absolutely correct. Certainly the smaller the base, the more energy is going to go to that area. All right, and you do need a dispersal electrode. Next question. Capacitive coupling. 1, can only occur when 2 metal instruments are touching directly. 2, can always be detected since the burn will be visible. 3, can cause stray currents to stimulate the abdominal wall muscles. Or 4, is prevented by using plastic anchors on metal trocars. So the question is, do you know what capacitive coupling is? All right, let's take a look at your answers. All right, so Wow, 50-50. The correct answer is 3. It can cause stray currents. So that's the capacitive coupling is the kind of coupling that occurs through an insulator. So, and that is the kind that can cause stray currents that usually you'll see on the liver when you're taking off a gallbladder with the cautery, or can cause the muscles to be stimulated when such an instrument is placed on the muscles. So it certainly it can cause undetected burns, and when two metal instruments are touching each other, that's not capacitive coupling. Using the plastic anchors on the metal trocars does not prevent it. So, I'm sorry? Yeah, it's the way to cause it, yeah. You won't see this question on the exam like this, but you will see other similar questions. Next question. Visually inspecting a laparoscopic instrument for insulation defects, 1, detects large defects which have the greatest potential of injury. 2, is the best way to detect small defects which have the greatest potential for injury. 3, should be done after every 10th use. Or 4, is the best way to detect large and small defects. I think we had a good discussion of this a moment ago. Yeah, it looks like, yeah, this one, it's supposed to be.
With actual test questions, so these are more for discussion. So the good news is if you are very confused and can't find a right answer, then you know what you're doing, because what I would say is there's no right answer.
This question is
in these answers
not worded correctly.
So it's not, so we can skip this one, but there is no right answer. None of these are correct.
We don't inspect every 10th use. We should be checking electronically the devices, the insulation on our devices after they're cleaned or before they're cleaned. Of course, visually inspecting does not detect small defects, which are the ones that cause the most harm. We can move on to the next question. All right, in which of these cases is a monopolar instrument preferred over bipolar? 1, the patient with a liver capsule bleed. 2, the patient with a pacemaker undergoing chest surgery. 3, when intraoperative needle monitoring electrodes are used. Or 4, a patient with a short gastric vessel bleed. All right, let's see how the response is, and it's kind of another odd question too. But you guys got it all right. How nice. So certainly the monopolar does not want to be used when you've got the pacemaker nearby, and the needles can also attract the electricity, and the short gastrics, well, we like to use other instrumentation other than bipolar for the larger blood vessels. All right, next question. Which of the following endoscopic energy devices does not transmit electrical energy to the small bowel? The snare, the heater probe, hot biopsy forceps, or bipolar, aka multipolar electrocoagulation, or MPEC? All right, let's take a look at your answers. Excellent. You guys were listening. The heater probe is not an electrical it's an electrical device, but it's one that uses heat and is a true cautery. All right. Thank you all very much.